Psychoanalysis in dialogue, careful caution. Careful caution deals with caution necessary in extending application of psychoanalysis to areas which are macro and outside of psychoanalysis. Point is, we should apply psychoanalysis, take psychoanalysis to various areas, expand this zone of psychoanalysis in dialogue. If we believe that psychoanalysis is the mother science in the zone of mind, then it should be able to add value to and be applicable to the entire humanities and social sciences. And this is where the dialogue comes in. That psychoanalysis can be used in dialogue with other areas of humanities and social sciences. But as we do it, we have to do it with careful caution. Point is not to do it. I would say we are doing less of it, so we should be doing more of it. But we should not do it with fanaticism and recklessness, and do it with careful caution. Psychoanalysis is the mother science in the zone of mind. So if we divide knowledge into knowledge of the physical world, knowledge of the living world, and the knowledge of that zone of reality which deals with the human mind and all that emerges out of the human mind, essentially humanities and social sciences, then psychoanalysis becomes the mother science in that zone of mind. And psychoanalysis has two broad areas of application: clinical application and non-clinical application. Clinical application of psychoanalysis is very popular. It has two broad clinical applications, one in the area of psychological testing, second in the area of therapy. Of course, in understanding human mind also, and in doing pure psychoanalysis also. So we have a clinical application and we have non-clinical application. Clinical application can be for testing, for therapy, and for pure psychoanalysis. To understand the human mind per se. You can call it a psychological application or an existential application. And then we have non-clinical applications. Just to correct myself, when we say clinical application, we will include psychological testing, psychotherapy, and understanding of the human mind from a clinical standpoint. When we take psychoanalysis to understand mind in general or help the patient do pure psychoanalysis from an existential point of view, we go out of clinical psychology, but still we remain broadly in the area of clinical psychology. At times we venture out into existential philosophy or spirituality. So those are non-clinical applications. So the clinical applications are psychological testing, psychotherapy, and the way meta-psychology in terms of clinical psychology. These are clinical applications. Non-clinical applications include using psychoanalysis to understand, analyze films, analysis of arts, be it painting, music, poetry, application of psychoanalysis in economics, politics, and spirituality. These are non-clinical applications of psychoanalysis. Pure psychoanalysis also is non-clinical because I should not say it's non-clinical, it's actually a mixture of clinical and non-clinical. The intent is not primarily clinical, but on the way it does solve clinical issues. So it's partly clinical and partly non-clinical. Anyway, to keep it simple, let us just focus on what is on the screen. Clinical applications include psychological testing and therapy. Non-clinical applications includes films, arts, economics, politics, spirituality. And when psychoanalysis goes out into other areas like films, arts, economics, politics, spirituality, It's an area that I designate by the term psychoanalysis in dialogue with other areas. Why careful caution is needed when we talk of dialogue with other areas? First, there is often a leap from micro to the macro. And psychoanalysis essentially is a very micro discipline. We have a long way to go before we can slowly graduate from micro to the macro. At present, we are not certain even about issues which are micro. We are fumbling in that area. It's a long way before we will be comfortable even with the micro, and then the question of macro will appear, will emerge. So in a way, it's a premature jump that we are undertaking. So there is a long way to go before psychoanalysis matures. It is certain about the micro and then legitimately tries to understand the macro. There is also a false sense of omnipotence in psychoanalysis. There is a false sense of certitude and ignorance of emergent phenomena as we move from micro to the macro. There is a false sense of certitude that we are done with the micro. We are sure about our knowledge and it's comprehensive in the micro. It's not true. Even in micro, we have a long way to go. And then we dismiss that there can be emergent phenomena in the macro. We also dismiss that discourse is very different from process knowledge of discourse. Psychoanalysis essentially is process knowledge. For example, if there is a philosophical statement that we should speak the truth, that is true into itself as an ideal. Now you can analyze it in terms of elemental motivations and again prove it from a psychoanalytic standpoint, doesn't make any difference. The process knowledge of the macro does not change the macro. Occasionally, process knowledge of the macro brings to the fore unhealthy motivations behind the macro, and in some cases, after that knowledge is acquired, we may change. But that is exception rather than the rule. So we are confusing process knowledge with discourse. Discourse is a much greater and higher entity than just the process knowledge of it. And we believe once we have the process knowledge, it exhausts the significance of the macro, whose process knowledge we have. That's not true at all. The macro discourse and the process knowledge of macro discourse are two different things. And psychoanalysis essentially is a process knowledge. It is not a discourse of values. It is not a macro discourse of how to live. So there is in this, we have to be cautiously careful because there are three problems involved in psychoanalysis at present as psychoanalysis gets into dialogue. One is the problem of inadequate knowledge at the micro, movement from micro to macro recklessly, false certitude about macro, false certitude about movement from micro to macro, false certitude about the macro, and ignorance about emergent phenomena which may lie hidden in the transition from the micro to the macro. And the fourth problem is confusion of heightened significance of process knowledge over the subject of analysis. So there is a discourse and there is a process knowledge of discourse, and we wrongly overvalue the process knowledge of discourse over the discourse. Does that mean we should not have psychoanalysis in dialogue? We should not take it to humanities and social sciences. If knowledge exists, why not to use it? Of course, we should use it. There is no question of not using it. In fact, I believe we are not doing adequate work of psychoanalysis in dialogue. We should be doing more of it, and it will enrich everyone. However, we need careful caution because in the past we have not done it and paid a heavy price for it. So The humility that is needed is to accept that we understand part of micro and even a smaller part of macro and have no idea about the emergent phenomena, if there are any, as we move from micro to the macro. Our understanding is far from confirmatory, it is essentially indicative, essentially supportive, at times even exploratory. We are too far, therefore, from a confirmatory understanding and therefore even further away from any prescriptive status to prescribe anything at the macro level. Despite all these limitations, and with careful caution, we must proceed to expand our engagement with humanities and social sciences for the enrichment of everyone. Psychoanalysis and dialogue has to be expanded. Some more issues we have to keep in mind as we do this, which strengthen the argument for careful caution. If we look into the history of psychoanalysis, we find there are periods of scientific fanaticism. Take for example, views on homosexuality at a point in time where it was viewed as perversion. And there was a consensus that it could be a perversion. Take a period in the history of psychoanalysis where narcissism was thought of to be only pathological. There was no mention of ordinary narcissism or healthy narcissism. Take the case of history in psychoanalysis where intrapsychic determinism was the only determinism. There was no determinism from outside. When we today talk of biopsychosocio, the socio part was completely out of the window. Even today, it's largely out of the window. Look at how we looked at intrapsychic determinism. We never looked at culture. And Kohut brought it out that the type of patients Freud used to see and the type of patients Kohut used to see are very different patients. Kohut calls Freud's group of patients as those suffering from drive frustration. He calls them the guilty man guilty of transgression, of drive frustration. And the type of patients that Kohut used to get, he calls them the tragic man, where the problem is of early life object loss, bad object, or early life unhealthy self-formation. And we see how culture-dependent psychopathology is. The type of patients Freud used to say, the hysterics, are no longer the easy patients to even find in hospitals. So much of it has to do with culture. Psychopathology is extremely cultural phenomenon. And we had the scientific fanaticism to say it's largely intrapsychic. But Kohut brings to the fore the point that there is almost a public health aspect in a cultural sense to psychopathology. Take the example of technique, where everyone had fanaticism about the length of the session or number of sessions per week. And in the Lacanian psychoanalysis, everything is far more flexible. In ISTDP, it's far more flexible and still they are getting results. So one point of careful caution also comes from the history of psychoanalysis, where there is a history of scientific fanaticism, of certitude at different points in history, and pouncing upon, attacking, and throwing out of psychoanalytic societies those who differ or those who innovate. Psychoanalysis also has a very strange entanglement with political correctness. From saying homosexuality is a perversion to now saying homosexuality is natural, there is nothing like defensive homosexuality. It is a jump from improper fanaticism to improper political correctness, from one problem position to another problem position. The fact is, homosexuality can be both natural or defensive, and defensive homosexuality is something that has to be worked upon in therapy. It is something that has to be healed, and the person has to be set free then to choose for himself. So, jumping from one extreme to another out of pressure of political correctness. So when between political correctness and truth, You choose political correctness, that creates a problem. And psychoanalysis has been in these problems many times over. Even today, it's in problem with in relation to psychoanalysis attitude on homosexuality, feminism, and wokeism. Is a spelling mistake, it's wokeism. So on all these three, between truth and political correctness, psychoanalysis has chosen political correctness, and that itself is a severe limitation the way psychoanalysis is. And therefore, even more careful caution is needed if you extend this kind of a discipline into macro analysis. And then, God forbid, if you take it into policy making. Spirituality is yet another area where psychoanalysis has been antagonistic to. There has been a blind hate towards spirituality. As people realize more and more spirituality is empirically testable and health giving, psychoanalysis has no choice today but to engage with spirituality. But we can see the attitude to spirituality is not based on merit, it's almost based on an ideological position of blind hate. One more limitation of psychoanalysis. And then with all these limitations, when you take it to the macro in a blind, reckless way, with riding on the horse of omnipotence and scientific fanaticism and self-righteousness, with almost like a tempest of narcissism, and you have a campaign like Make America Sane Again. We should start with Make Psychoanalysis Sane Again, if we have to take psychoanalysis to make America sane again. So it's like healer, heal thyself. So psychoanalysis, heal thyself and then go out to heal others. When an argument comes between somebody trained in psychoanalysis and somebody not trained, the classical position the psychoanalytically trained person takes is this: my argument is rational and yours is pathological or a defense. And to be fair, people are tired of this defense. So these are the reasons where the limitations of psychoanalysis has to be accepted. The potential of psychoanalysis has to be even more accepted. Psychoanalysis and dialogue has to be done even more, but with careful caution, incorporating all these points that we have discussed. That will give us fairness, legitimacy, judiciousness, and humility to bring our resources and immense knowledge of the internal world that we have. Psychoanalysis is the most powerful theory of the internal world that we have. And we must bring this powerful resource to analysis of everything in humanity and social sciences, but with a careful caution. How do I see the future evolving in the light of what we have discussed? I believe we should do a graduated application followed by public discussion. That should be point number one. There should be a respect for common knowledge and traditional knowledge, which is macro, and process knowledge of the macro should not be used to overturn the macro for the sake of it or for the sake of some ideological belief. Respect the macro as a distinct category and not as an area for extended application of psychoanalysis. We don't know what emergent phenomena, if any, lie hidden there. Humility of a process knowledge as being process knowledge. Clear acceptance that psychoanalysis is not theory of everything, not even in the essential sense. And the fact that we are not an aggregating discipline like philosophy, which would take the best of everything and create a holistic vision. We are not a vision discipline. We are not a theory of everything discipline. Philosophy remains the king, which would have to put everything together and create a holistic vision from which a perspective of life and from there policy would emerge. So this was a short session on psychoanalysis in dialogue and issues involved in taking psychoanalysis to the macro and to much of humanities and social sciences. Thank you.